Welcome to eCancer in March 2018. We're happy to remind you that ecancer.org is an accreditor of CMEs. In other words, not only is our educational content accredited and earning CME points, but we are now licensed to accredit other people's e-learning education modules. So that's a big feather in our cap. We have two to boast about this month. Two are bony topics. One is on how to manage osteonecrosis of the jaw. This is a new complication of new bone targeting agents. Very difficult to handle, especially as most oncologists don't know much about dentistry, and this involves dentistry and management of the bony structures of the jaw. I certainly commend that to you, and that gets you one CME point, and then also a very good educational module on bone metastasis, management of bone metastasis, not unlinked to the osteonecrosis of the jaw. And bone metastasis gets you also one CME point. Also, the video team have been very busy, as you know, in ASCO GU, and there are a couple of videos that they'd like to highlight. The first is by Dr. Kolmenberg, and he's talking about the management of marker negative stage 2 testicular cancer. Not a common situation, and worthwhile learning about it. And the other topic from ASCO GU is Dr. Sanpardu, who reviews cancer research in the urothelial cancers as a block. Then on to our articles and our reviews, and they come from 3 or 4 subcontinents or continents or regions. One from India, one from Egypt and Saudi Arabia, and 2 or 3 from Latin America. And there's a couple from Europe as well. We'll start off with an interesting topic from India, from Indore, the palliative care problems which they have encountered in their Head and Neck Institute. Palliative care is not particularly well done in any country. India shares with many other countries a lack of trained doctors and support care teams who know about palliative care and who understand the special problems of looking after patients with palliative care. And these aren't only cancer patients, you must remember. And the second problem in India, which is discussed as socioeconomic problem in India, fast-growing economy, and unfortunately many patients get left behind because they're not covered with insurance. So this is well worth reading, and a paper comes from Dr. Darkar in Indore. Then over to Argentina, a really good review. It's not a socioeconomic review, this is more future medicine, and it's a paper from Dr. Miani and a team from the Inter-American Open University, and they're looking at adipose tissue stem cells in regenerative medicine, and they're reviewing the whole area of getting at these most important and most flexible and most clever stem cells from adipose tissue, easy enough to get at, and how they can be used in helping in regenerative medicine. One thinks immediately of breast reconstruction, but there are many other areas where stem cells will have, in my view, great potential, and not just in oncology. Then 2 interesting case reports from Latin America. The first one is a case of a patient, a 60-year-old patient who had a duodenal carcinoma, an adenocarcinoma, inoperable, and was treated with chemotherapy, 6 cycles of oxaliplatin and capecitabine, and produced pathological complete remission. Had a duodenectomy combined with a pancreatectomy, and after 34 months, complete remission, pathological complete remission, this unfortunate lady developed a second primary carcinoma of the breast. So she'd had a primary breast cancer before the duodenal cancer, and then a second one afterwards in the contralateral breast. Duodenal carcinomas are 0.3% of the gastrointestinal tract carcinoma. So really interesting, and just most unfortunate in a lady who had 2 separate breast cancers. The pathology is clear. These are separate 3 cancers. And then the second case report from Latin America comes from Sao Paulo in Brazil, from Dr. Marta and colleagues. And this is observation of cystic brain metastases. And this occurred in a patient that they treated with an ALK-positive, ALK-rearranged non-small cell lung cancer, who responded very well to crizotinib and relapsed in the brain. And it turns out that this is maybe going to be a problem in the future, because they managed to find in the literature 6 other cases of ALK-treated patients with non-small cell lung cancer who develop cystic metastases in the brain. There's an interesting discussion on how you would treat these. The most obvious thing you might think about doing is giving chemotherapy, but I don't think crizotinib is very good at getting into the brain. But tyrosine kinase inhibitors are, and the patient that they describe had a good but short symptomatic remission from a TKI, which did get into the brain. TKIs can be used with radiation therapy in primary treatment of cystic metastases in the brain. So something worthwhile looking out for the future. And now to Africa, Egypt to be precise, and the highlights from the Egypt meeting on gynae and immunotherapy, International Cancer Conference. It was in January. We filmed it, and if you're watching our videos carefully, you'll already have seen the highlights and the interviews. And I'm just pointing to you to read the commentary from Dr. El-Ghazali, and this is a good companion to the videos that you've already watched, I hope. Also from Egypt, but also partnered with Saudi Arabia, the Riyadh team in Al Faisal. And this is Dr. Kekri is the lead author, and this is an interesting discussion of obesity in patients who already have breast cancer. And is this a good thing? There's a lot about obesity being a risk factor for breast cancer, and now we're beginning to accept this and accept that lifestyle is going to be an important part of prevention of breast cancer. And this group of doctors in Cairo and in Riyadh looked at a largish series, consecutive series of 300 plus women with breast cancer who were given adjuvant letrozole. So their breast cancer was managed locally and they were on adjuvant letrozole. And the question was, what about obesity in women who've had their cancer treated? And 2/3 of these women had clear-cut, defined obesity, and they did not do worse on the letrozole than the patients who were not obese. So that's some good news about obesity. There's not a lot of that around. Then sticking with the issue of lifestyle and of self-management, there's a really interesting paper from a group in Holland. The last author is Anton Hagebeek, whom I used to know from Rotterdam. He's now running hemato-oncology at the Academic Medical Center in Amsterdam. This is teamed up with 2 other colleagues in Bilthoven and in Utrecht, and they're looking at eHealth, and they're exploiting it to coach patients with cancer self-manage. And it's all about fatigue. And the program is called Untire. Stop being tired, sort your tiredness out. And it's a really interesting program. And of course, it appeals to eCancer because it's about eHealth. And this is a program which has been running in Holland, it's been validated, and it really works. And it coaches patients with cancer dealing with their tiredness and their fatigue. Obviously, if there's some clear-cut cause of the fatigue at this moment, then this is not a big deal, but many patients suffer from fatigue months, years after their radiation therapy or their chemotherapy. And this is really interesting program looking at psychoeducation with cognitive behavioral therapy, mindfulness, physical activity, stepped care and blended care. And I would certainly commend this to you. I hope you've seen, advertised it last month, the precision medicine videos from our meeting which eCancer ran in IFOM in Milan. And this was a first-class meeting, as you will have seen if you've been watching the videos. But now I can commend to you the authorized description of the guts, the bones of the meeting from Luca Mozzarella. And he writes a very nice, very clear description of the meeting, pulling out the most important parts, particularly the future of precision medicine as we know it. And we'll read, no doubt, and watch, no doubt, a lot more about precision medicine in the future. That's all for March eCancer.